Foot pain is a common issue. We know that foot pain is classified into hindfoot, midfoot, and forefoot pain. In the previous video, we discussed about hindfoot pain. In this video, we will discuss midfoot pain. Let's get started. The midfoot is comprised of three cuneiform bones, the cuboid and the navicular bones, as well as the surrounding soft tissues. These bones and joints form the arch of your foot. It's crucial for maintaining balance and shock absorption. The first step in any physiotherapy assessment is gathering a thorough patient history. Onset of pain is sudden or gradual. Pain starts suddenly and may indicate an acute injury such as a fracture, ligament tear, or sprain. Stress fracture of navicular bone causes sudden onset of pain. Pain develops slowly over time. It might be due to overuse injuries, muscle weakness, or degenerative conditions like arthritis. This type of pain does not have a clear starting event. Tibialis anterior tendinopathy occurs due to muscle weakness. Pain in midfoot occurs centrally, medially, and laterally. It can be due to conditions like midfoot arthritis or stress fracture. It indicates problem with the posterior tibial tendon or navicular bone. Pain on the outer side can be associated with peroneal tendon issues, cuboid syndrome, and dorsal calcaneocuboid ligament injury. Nature of pain is mainly classified into three types. Sharp pain often indicates an acute injury like a fracture or ligament tear. Dull pain could be related to overuse injuries, arthritis, or stress fracture. Burning pain is often associated with nerve involvement such as tarsal tunnel syndrome. Ask if patient does any sports that involve sprinting, jumping, or hurdling. Recent increase in the training load, or is a ballet dancer. Stress fracture of navicular bone is common in such activities. It can lead to tibialis anterior tendinopathy. Cuboid syndrome is common. If a patient has history of tight shoelace, tibialis anterior tendinopathy can be present. Check if pain radiates along the medial aspect of the longitudinal arch. Ask if the symptoms subside rapidly with rest. It can be stress fracture of the navicular bone. Check for the signs of partial avulsion at the insertion of tibialis posterior tendon. It is probably due to tibialis posterior tendinopathy. Difficulty during lateral weight bearing can be due to cuboid syndrome. Stiffness of the first metatarsophalangeal joint occurs in tibialis anterior tendinopathy. Excessively pronating foot is seen in first metatarsal joint pain. Four major locations are palpated: end spot, insertion of the tibialis anterior tendon, dorsolateral aspect of the calcaneocuboid joint, and plantar fascia. Tenderness along with mild swelling at the base of the first metatarsal and the cuneiform confirms tibialis anterior tendinopathy. Localized tenderness and swelling is seen during dorsal calcaneocuboid ligament injury and plantar fascia strain. Palpable nodule may indicate a partial rupture of the plantar fascia. Resisted dorsiflexion and eccentric inversion may elicit pain if stress fracture of the navicular bone is present. Excessive heel strike or overstriding during running may indicate tibialis anterior tendinopathy. Resisted eversion and hopping reproduce pain during presence of peroneal tendinopathy. Resisted inversion of the foot elicit pain if dorsal calcaneocuboid ligament injury occurs.